everybody. Hello there. Hi. Good evening and welcome to my hometown, Chicago. It's a pleasure to have you here. My name is Christy Petersen, and I'm your scientific program chair for this meeting. We're so happy to have you here with us this week in the Midwest, again, my country, and we promise you a great meeting this week. Associate Program Chair Stephen Popper and I, along with the 135 members that are sitting out amongst you, and our amazing hardworking staff, have all been busy really over the last year getting this meeting put together and assembling an exceptional gathering of science. During the next 3.5 days, we hope that you'll find an opportunity to attend a variety of sessions covering a broad range of topics, from research in the basic sciences, to clinical updates, to reports on improvements of program operations, and topics of concern to our international members. Also, importantly, we try to bring content that's really good for our trainees and our students. And please let us know if you'd like to hear other things. Thanks to all of you for all the effort it took to come here. I know that I've talked to several really jet-lagged people. We do have coffee, I promise. And we have over 4,000 attendees registered this year, in person as well as virtually, through our live stream sessions. Together, as a group, we represent over 100 countries. And it is your contributions and willingness to share your latest insights in science that we are able to plan this amazing informative program that you are about to experience over the next week. The theme of this year's meeting is From Evidence to Action, and you will see plenty of action this week, represented in the stimulating research, clinical advances, and special guest lectures. It's a lot over 3.5 days. It's 13 concurrent sessions, so I know that everything won't fit perfectly. There will be some overlaps. I'm sorry, we tried. But if you can't make a particular session, or if you want to review that session again after the meeting, all of you as registered attendees have access to on-demand content until October 1st of next year, and the e-posters will be available through April 30th. So go back and look at it again when it's not quite as crazy. One note I need to make, though, this is me asking for forgiveness, is except for the year's live stream sessions, the ones that are held in this room, which you have full video, the on-demand content in the other rooms is going to be slides and accompanying audio. If you attended the meetings before the pandemic, you'll remember that's how we offered it then. So that's what it's going to be, slides and audio. Before I introduce our host for this year's plenary evening, I would like to acknowledge our generous sponsors. Their contributions make this annual meeting the success that it is. They are the Bill and Melinda Gates Foundation, principal sponsor Abbott, Takeda Vaccines, Doctors Mark and Cindy Korpeter, Pfizer, Novartis, Malaria Foundation International, Parasites Without Borders, Sabin Vaccine Institute. I also want to acknowledge our supporters, the Burroughs Wellcome Fund, and IAMAT, the International Association for Medical Assistance for Travelers, and our contributor, eMed. That's why you guys got tests and masks, so please use them if you're feeling sick. We also want to acknowledge the corporate sponsor for the Young Investigator Award, Pfizer, and the Friends of Young Investigators, which is an anonymous donor, William A. Petrie Jr., in honor of William A. Petrie Sr., and all the individuals who made the donation during registration and throughout the year. Thank you. Finally, I'd like to remind everybody about the exhibit hall. That's where the food is. So many organizations and companies that support tropical medicine are there, and ASTMH, and all that we do. Please take some time to visit them and learn about their newest services and products, starting at the opening reception tonight. It begins right after this, and it's in the Riverside Center exhibit level, East Tower. So you go one floor, and it's there. Just do what I do and follow the crowd, and we exit from here. The exhibit hall is where you're going to have your sandwiches for lunch, and that's where the coffee breaks will be too. This year, to try to represent a little bit better climate impact of the meeting, we're doing something a little different. Our Green Task Force has arranged for us to enjoy a delicious, nutritious, meat-free lunch for Friday. This will be a first for the society, and hopefully something that we will continue to have a less impact on our planet. We also organized 2 outdoor walks around downtown Chicago to view the fantastic and amazing sculptures of our local artist, the African-American sculptor, Richard Hunt. Here's one of the sculptures. This is the one that's actually going into the Obama Presidential Center. And the kind of awkward-looking, tall Midwestern guy, that's my dad. Say hi to him. I'm not kidding, it really is my dad. So the tours are going to start at 3:30 p.m. on Thursday and Friday. If you're interested, meet us in the lobby level. So that's the front drive, Wacker Drive entrance, and you can find the information on the app. There's also several signs around the meeting about it. And if you haven't downloaded the app yet, come on, guys. This is where all the info is. You need to do it. So it's easy, it's convenient, it's much more searchable than it's been in past years. I'm really excited about it. Thank you, Doug, wherever you are. And it's where you're going to find access to really everything in the scientific program. And now, it's my great pleasure to introduce ASTMH President Dan Bausch.
Wow. Welcome, everyone. So this is Christy's last year as scientific program chair, and I want to thank her and Stephen Popper for all they've done to put this together. It's an amazing program, as she's told you about. And it's a year, many of you were there with us last year in Seattle, and so this is our second year in person after those difficult years where we were all online, so it's great really to be back in person with everybody. I can't claim to have Chicago as my hometown like Christy does, but nevertheless, I am kind of a Chicago kid in some ways. I went to Northwestern up the road as an undergrad, and then did research for a couple years at University of Chicago and medical school at Loyola, so I think I can claim Chicago a little bit as a hometown. It's great to be here. But really appreciate Christy and Stephen, the work that you've done. So the way that this works is that I'm going to talk for just a few minutes, and then we're going to go on to an amazing speaker, Ambassador John Nkengasong. I'll introduce him with a little bit more detail in just a few minutes. And then after that, we're going to move on to various different awards and medals, really important, great to see the people who are recognized for incredible work. We're also going to recognize those of you who have been here or paying any attention know that our CEO, Karen Gorleski, after 13 years, is moving on, and so we're going to have a few words with Karen and some surprises there, perhaps. Who knows? Karen, we'll have to see. And so don't miss that. So it's really going to be an exciting program. So first of all, I want to give a very special welcome to everyone, but especially to our members. Really important that we have membership, and so there's a lot of people here. I won't call you out or ask you to stand, but there's people who have been members for 10 and 20 and 30 years. And just for those of you who aren't members, the society, this is the flagship event for our society, is this meeting, but it's not the only event and the only offering, and so being a member is really something, it connects you to a network and a lot of things across the year that we do feel has value. So encourage you to, of course, to keep coming to the meeting, but also to maintain that membership and that engagement throughout the year. So let's have a round of applause for all the members. Last year, we announced the Mwele Malesela Mentorship Program for Women in Neglected Tropical Diseases. The fellowship supports mid-career African women to become leaders and champions in NTD elimination at national and international levels. I'm pleased to announce that the first fellowships will go to, and I'll name quite a few people here. So Shinenye Bembir, Basiliana Mdidi, Deborah Mensa, Orlayo Toyin Emmanuel, Lydia Mosi, Christine Wanjala, Kenye Aline Christel, Faraja Serafen Layamuya, Rose Elizabeth Peme Motoi, Dosa Nisu Ines. Congratulations to all. I also want to congratulate the team from the Center for Vaccine Development at Texas Christian Hospital and Baylor College, led by past President Peter Hotez and Maria Elena Botazi, the elected leader of the Global Health Subgroup. The center received the 2023 David and Beatrix Hamburg Award for Advances in Biomedical Research and Clinical Medicine from the National Academy of Medicine. Drs. Hotez and Botazi are both attending this year's meeting, so if you see them, do congratulate them and give them your best. We also want to give as I mentioned, we'll give a big thanks to Karen a little bit later in the program. I want to highlight a few things that, it's a great program throughout, but I want to highlight a few things that I think will be special this year. Some of you may know that through just various circumstances, I had the privilege to be president for 2 years, which is not the norm in the society. So last year, I gave my president's address. I hope you heard it last year, or you can still go back and listen to it. It was on the nexus of tropical medicine and human rights. You may be happy to know that this year I won't just be speaking again, and it won't be all me. Rather, I thought, since I had my opportunity last year to really give you my thoughts, that this year it'd be good to get some wisdom of the ages. And so I've invited some of the past presidents to join me for the president's address, and also some of the trainees and young investigators to submit some questions. So we'll get their thoughts from the president's thoughts on kind of what the future of the trainees and young investigators, the opportunities and challenges, and then on a bigger scale, what the future holds and the challenges for the society and for all of us who are working in global health. So I hope you'll join me for that, which will be a special format for the president's address. This year's commemorative lecture will be Kemi Ogundipe, the pediatric advisor from Médecins Sans Frontières. She's a physician organizing clinical care for people in places of conflict and different areas around the world. And I think it's safe to say we all recognize that we certainly need people who organize care in areas of conflict, because there's a lot of conflict going on in the world, and we certainly remember those, and our hearts go out to people who are suffering in those conflict areas around the world. I also encourage you to stick around for Sunday's special plenary, Waging Peace, Fighting Disease, and Building Hope, a tribute to President and Mrs. Carter. And so this is really going to be a great event where we talk about the legacy of the Carters and all the work that they've done, and the Carter Center over many, many decades in terms of and their dedication and advocacy and diplomacy. And so definitely stick around for that on Sunday morning. You can check the meeting app, as Christy said. Thanks again, Doug. All these, it's all there for you. And so pick out the things. It's all the science, all the public health, everything that really you could dream of, I think, if you're interested in tropical medicine and global health over the next few days. And it is, as Christy said, a lot, but digest what you can. And some students were asking me earlier, what do you recommend? And people who come here for the first time, and one of the things I said is a lot of the content is in the room, but a lot of the content is outside of the room too. So don't be shy. And tropical medicine people are generally pretty friendly, nice people. There's a few cantankerous ones. I won't name names, but you know who you are. But they're generally pretty friendly, and so if you see people who are doing some neat things, and you think, yeah, maybe I'd want to do that, I want to get involved with that, go introduce yourself, and so get the education inside, but get the education outside in the hallway as well. So now it's really my privilege to introduce our keynote speaker, Ambassador John Nkengasong. And John, if you'd come to the stage, please. John Nkengasong was selected to lead the new U.S. Bureau for Global Health Security and Diplomacy that was launched in August. The Bureau's mission is to fortify global health and help prevent, detect, control, and respond to infectious diseases, including HIV/AIDS, through international cooperation. Dr. Nkengasong serves as Ambassador at Large, the U.S. Global AIDS Coordinator, and Senior Bureau Official for Global Health Security and Diplomacy, reporting directly to U.S. Secretary of State Antony Blinken. Prior to this role, and the context where I first got to meet John, was as his role as the founding director of the Africa Centers for Disease Control and Prevention. Through Dr. Nkengasong's leadership, a framework for transforming Africa CDC into a full autonomous health agency of the African Union was established. He also led the COVID-19 response in Africa, coordinating with heads of state and governments across the continent, and helped secure 400 million doses of COVID-19 vaccines at the height of vaccine scarcity. He previously served as acting Deputy Principal Director of the US CDC Center for Global Health, as well as the Chief of the Division of Global HIV and TB's International Laboratory Branch. He has received numerous prestigious awards and recognitions, including the rare honor of being knighted by the governments of Senegal, Cote d'Ivoire, and Cameroon. In 2022, he was invited to join the National Academy of Medicine, and he became the first laureate of the Virchow Prize for Global Health. On a more personal note, in my role as ASTMH president and elsewhere professionally, I've had the privilege of meeting many prominent people and incredible people over the years, and they all have many impressive attributes. But I've met few, very few, who combine the intelligence, strategic thinking, compassion, and leadership of John Nkengasong. He's someone who I admire on both personal and professional levels. Every evening with John is an educational evening, and I'm sure that tonight will be no exception. So, John, the floor is yours.
Thank you, Dan, for your kind introduction, and good evening, colleagues. Thank you, Karen, for inviting me, and thank you for your leadership in global health all through the years. The society that you've led has played a critical role in shaping global health. Truly an honor and pleasure to have been invited to give this address. I sat there minding my business and thinking about the lecture, and so many of the society members walked up to me and started making me looking nervous. They said, "Oh, we are looking forward to your talk. We are really excited. We want to lead." I said, "Leave me alone. I was minding my business, and now you make me nervous about the talk." So, really, what I wanted to do this evening is to discuss global health, security, and draw lessons from two pandemics. I've been personally, I wanted to use the word privilege, but for lack of a better word, I'll use it. Privileged to be in the theater of response for both HIV, started by HIV career in 1988, Ebola crisis multiple times in DRC, and as Dan said, the COVID-19 response. In all of that, I kind of put my head together and said, what are some of the personal lessons that you've learned over the years? So the slide you see here is a framing slide, where essentially I want to remind all of us that pandemics have challenged humanity for centuries and will continue to do so. What you see at the bottom there is just a timeline of how pandemics have occurred, including the famous one in 1918, which killed about 100 million people in 2 years, or 50 to 100 million people, which at that time represented about 5.5% of the world's population, which was about 1.8 billion people at that time. And fast forward in the 90s, HIV/AIDS was recognized, and today HIV/AIDS has resulted in the deaths of about 40 million people. And COVID-19 pandemic that we are still dealing with somehow has resulted in the excess deaths of about 25 million, an unknown virus that just a few years ago we were dealing with. Different factors account for the state of affairs, the population growth, rapid movement of people, climate crisis, environmental factors. Over and over, we were warned. The Time magazine carried this publication before the COVID-19 pandemic. It says, we are not ready for the next pandemic. Before then, there was no COVID. So today, what I want to do is to share with you some reflections, what I call the 5 Ps for managing pandemics and health security, drawing from my own experience and reflections. That includes knowing the politics, the population, the policy, the partnerships, and the pathogen. And I'll draw my inspirations from, as I said, HIV/AIDS and COVID-19, and remind all of us what this famous author, George Sanatarian, once said. He said, in quote, "Those who cannot remember the past are condemned to repeat it in future." So I would use HIV/AIDS response in Africa, specifically because as the head of PEPFAR, PEPFAR is celebrating the 20th anniversary this year. But when I share that experience, I want you to look at it in the context of the 5 Ps that I just walked you through, and the COVID-19 response, and then draw some inspirations for global health security in the spirit of the theme of this conference, which is evidence to action. I will support each of the Ps with evidence, and then I will conclude with some actions. So let's look at the politics. In 2015, Peter Piot, the founding director of UNAIDS, wrote an interesting book. He titled it AIDS Between Science and Politics. He essentially said in that book, it's a thick book like this, but what I remember in that book, he says, science does little good when it operates independently of politics and economics. And politics is worthless if it rejects scientific evidence and respect for human rights. That was true then. It is true today in the context of what we are dealing with. So let's look at HIV/AIDS in Africa. About 20 years ago, this was the face of HIV/AIDS in Africa. A face of helplessness, a face of hopelessness. The front covers of prestigious newspapers like Times Magazine will carry often, and Newsweek and influential papers carry the front page that looked like that. You can see the desperate, hopeless, and helpless face of a young kid being managed by, I can assume that that mother is a grandmother, and also looking helpless and wondering what will happen. And he says something that I would invite you to read that. He said, this is the story about AIDS in Africa. Look at the pictures, read the words, and then try not to care. HIV/AIDS had dramatically altered the life expectancy in several African countries. As you can see on this curve, life expectancy was dropping, like in Botswana, Zimbabwe, Lesotho, South Africa. They are decreased by 12 to 35 years. Not only did it impact life expectancy, it had a tragic effect on the economic development of the continent. GDP had dropped about 2.6 percentage points. About 22% of the cost of HIV was a burden on the general cost of that country, of each country. ARVs were available in the mid-90s, and you can see the blue line show you the drastic decline in mortality, in deaths in the United States, but mortality continued, due to HIV/AIDS, continued to increase in Africa. And between that period, that is mid-90s, 1996 to 2006, a 10 years period, about 10 million people died because of lack of access to treatment. Then good politics came in. First of all, when in this White House ceremony, President Bush, President Obasanjo, and Kofi Annan, the Secretary General of the UN, all came together to discuss about setting up a fund, the Global Fund, which today, because of that good politics, had resulted in about 50 million lives saved, has raised over $55 billion. Then on the 29th of January, 2003, President Bush caught all of us by surprise in the State of the Union address. He said, and I quote, "Seldom has history offered a greater opportunity to do so much to so many." That was good politics. I've always said, or reminded myself that good politics plus good public health saved millions of lives. This was the epitome of good politics. PEPFAR today is in 55 countries, invests, and I use the word invest deliberately, about $7 billion a year in fighting HIV/AIDS in the 55 countries, have invested over $110 billion over the last 20 years in fighting HIV/AIDS in several countries. Just a few days ago, the former president of Botswana, a respectable president, a leader, Festus Mohad and Tommy Thompson, who was the Secretary of Health of the United States at that time, wrote a joint commentary in The Hill, and they said, "How PEPFAR helped to save Botswana from extinction." How PEPFAR helped to save Botswana from extinction. The power of good politics, when good politics meet good public health. Today, PEPFAR has saved about 55 million lives, 5.5 million babies born free of HIV/AIDS. HIV/AIDS-related deaths have decreased about 68% since the peak in 2004. The rates of new infections have decreased about 42%. In addition to life outcomes or impacts, in terms of developmental outcomes, GDP per capita has increased about 2.1 percentage point in countries that PEPFAR has supported. Child mortality has decreased about 35%. The rate of young girls dropping out of school has decreased about 9%, and the rate of immunizations have increased about 10 percentage points. This is data independent from PEPFAR, but published by the Kaiser Permanente family. This is a graph that was published recently in The Lancet by a UK group of researchers. They might be here. Very powerful. It shows you in blue when PEPFAR just started, the rates of decrease in children orphaned of HIV/AIDS, the prevalence of children orphaned by HIV/AIDS, and pediatric HIV/AIDS infections decreases in Lesotho and pediatric AIDS. You can see the drastic, remarkable downward trends in all of these countries, thanks to the investments that PEPFAR had. When I was confirmed in June of last year, I went to visit with President Bush, and I showed him a little picture. And I asked him, I said, "President, what made you to launch PEPFAR?" He said, he reflected, that was his most lively moment. He said, in that 1-hour conversation, he said to me, "Mr. Ambassador, to whom much is given, much is required. I believe in God, and God has blessed this country." And Condoleezza Rice came to me and said there was a whole continent that was going to be extinct because of HIV/AIDS. And I said to her, "Bring the evidence, and I'll act." He brought the evidence, and he said, "I took Congress by surprise." That is a picture that I was showing him. It was a little baby that, after his presidency, he visited Ethiopia and carried that baby. That baby is born free of HIV. The mother sitting there in white is HIV infected, but because of ARV is alive, delivered that healthy baby. I just wonder what is going on in that baby's mind. probably saying, Mr. President, thank you, but not knowing how to say thank you. That is the power of what good politics does in pandemics. We in public health know what the issues are. We can diagnostic, publish it in the New England Journal, in Science, in Nature, but without good politics, we have no way of carrying it forward. So let me turn my attention to population. I've said at least 3 times in this lecture the power of, or the equation of a combination of good politics, good public health. Good public health means we have to know the population. Knowing the population means we have to target the resources where the needs are. We are not out of the woods from HIV/AIDS pandemic. I deliberately use the word pandemic. This is a graph that I borrowed from the UNAIDS, and it says very clearly, shows that we've made remarkable progress in the fight against HIV/AIDS, but we may miss our 2022 targets. We may miss the 2022 targets. Our ultimate goal is to bring HIV/AIDS to an end as a public health threat by the year 2030, which means by 2025, as many countries as possible should get to the 395. What does that mean? For those who are not familiar with the jargon, it means 95% of the people who are infected should know their status. Of that, 95% should be put on treatment, and 95% should have viral load suppression. Countries are at very different stages of getting to that. If we truly have to get to that target of 2030, we have to be aggressive and know that HIV/AIDS is not over. But we have to know the population, because HIV/AIDS is not widespread as it used to be. And this is a selection of a few countries that have exceeded or are close to achieving the 395. They include Botswana, Eswatini, Malawi, right up to Zimbabwe. If you look at these results, they tell you a different story if you are looking at adults 15 years and above. Now, if you just take Botswana, Eswatini, and Malawi, and you do a deep dive into that, and you look at the population between 15 and 24 years old, it tells you a different story. You can see how the graphs have now decreased. For example, in Botswana, only 85% of young people between 15 years and 24 years actually know their status. And if they don't know their status, they cannot be treated. Look at Eswatini. It has decreased to 85%. And Malawi, that if you aggregated all the data, showed you that they were close to 95%. The young people there, that percentage had decreased to about 76%. I guess the question is, what happens when you get to the 395? When you get to that 395, you see the blue line, which is the rate of new infections, is decreasing so quickly that it's beginning to cross the red line, which is the total number of deaths. That's what we want to see across the countries that are achieving the 395. If you look at Mozambique, for example, a country that is not close to the 395, you see the blue line is flying right up there, which is the rate of new infections will continue to increase, and the rate of deaths continue to increase. You see a decrease there in next rate of new infections, but it's not crossing that red line. That's what we want to do, is bring the blue line down, cross it, close the tap so that the rate of new infections are completely knocked off. So in Mozambique, again, leading with data, knowing your population, you have to ask yourself the question, where are all the infections coming from? 81% coverage of ARTs, antiretroviral treatment, but most of the infections are coming from 10 districts. And about 59% of the women do not know their status or are not in treatment, compared to 41%. That is the power of using data to guide your interventions. And this is so important in that country, because if you look at this graph carefully, it shows you what you call the population budge. See, a large number of young people who start getting into the sex at the age of 15 going forward. And if the rates of new infections are not down enough, then you get into problems, because all the gains that we've made over the years will be compromised. Remember, these young people didn't see the ugly face of HIV/AIDS. So it's becoming very, very problematic to convince them to pay attention to this pandemic. Policies. Bad policies obstruct our interventions. This is a study that I'm sure one of you published in The Lancet, and it shows clearly why structural interventions to address equities is so important. It shows the association between policies that criminalize and segregate and the rate of fighting HIV/AIDS. Like what we're currently doing with laws that penalize the LGBTQ population. You cannot win the fight against HIV/AIDS without addressing those gaps. This graph shows you what happens if certain segments of the population are discriminated or are stigmatized. Here in Zimbabwe, you see in the blue line the adult population, and the second bar, which is the first 95, shows men who have sex with men, and the last bar in red are transgendered women. So you can clearly see that in the total population, general population, about 90% of the population who are infected know their status, and they subsequently will receive treatment and get virally suppressed by other populations are left behind. We are not going to win the war against HIV/AIDS by leaving other populations behind. Same for policies that are not taken up. For example, access to treatment or HIV services amongst adolescents aged 12 years and above. If you look at the bar on your left-hand side, it shows you East and Southern Africa, where only 38% of those policies are implemented in East and West in Southern Africa, and only 12% in West and Central Africa. Now you begin to see why there's so much discrepancy between HIV/AIDS response in West Africa and in other parts of Africa. So policies matter. Partnerships. I call it respectful partnerships facilitate courageous discussions. In Eswatini, despite the progress that they've made, you have a serious issue with gender violence, and the rate of new infections amongst adolescent girls and young women is about 6 times higher than in the corresponding age in boys. So I met with the king in the morning at the 5 o'clock meeting. I said to the king, we have to talk, we have to dialogue. And I was telling him, giving him an award saying, look, you've made progress, your country is close to the 395, but you have a problem, and I need your voice. I need your voice to address gender violence, especially issues that are creating problems amongst adolescent girls and young women. Same in Tanzania. Met with the president, and we had a very open dialogue with Petersen and the UNAIDS, Angeli. At the end, we said to the president, you're young, the rate of infections among the young women and young girls is unbelievable. Madam President, you have to do something. That is the power of partnership. She said, Mr. Ambassador, take my word, we are going to focus in that age group there. So the power of partnership with the country, that we are working in global health, respectful partnership that respect them and listen to what the countries are saying matters. Let me conclude the first phase of this by looking at the pathogen. We've lived with HIV/AIDS for more than 40 years. And the more we continue to understand the pathogenesis of HIV/AIDS, understanding the molecular structure of HIV/AIDS, more interventions and more drugs are developed. My intent here is not to walk you through the life cycle of HIV/AIDS, which we all have seen over and over, but rather to focus on the red crosses there, which shows you where, because of the improved understanding of this virus, we continue to develop new drugs that are very, very potent. To the extent that when we all started treating HIV/AIDS patients, it was a handful of a cocktail, of truly a cocktail. Today, because of the science, what science have done and an improved understanding of HIV/AIDS, you just need one drug. To the extent that we're all excited with the long-acting PrEP, that an injectable could be administered in certain populations every 3 months or so, or who knows, every 5 months. To the extent that we are beginning to believe in the possibility that we may have discoveries that will teach us how to cure HIV/AIDS in the long future or vaccines. So let me turn my attention to COVID and share those same lessons there. This is where we were in January 20th of 2020. We all woke up and we heard stories on TV about some infections happening in Wuhan. And personally, I didn't know where that was. I Googled quickly, as we all do, to find out where Wuhan is. But by 15th of February, 28 countries have already been affected. By the 1st of March, 66 countries have been affected. In 2 months, 165 countries had been affected. It shows us a common connectivity. And this is a picture. This is not 1918. This is a picture just 3 years ago. I know pandemic memory fades very quickly, but this is a picture that we dealt with at the height of the pandemic. It teaches us about our common vulnerability in pandemics or health security, that it's not about others, it's about all of us. So let me now look at review politics. What did politics teach us in the COVID-19 response? And I'll try to focus in Africa, then go out of Africa and look at vaccine, the COVAX, a little bit. The date of this publication is important. This is still in February 27, and only one country, Egypt, had reported the first cases of COVID in Africa. I published a paper in The Lancet at that time warning the continent about the looming threat, was still a threat of COVID. But urgent, as the theme of this meeting is calling us to do, to use evidence to act. We said it was time to act collectively and act fast. At this point, I'm posed to be grateful to Dan for you sending me a bunch of responders from the London School during your time at the London School to fly into Addis Ababa and support. I remember Dan and I having a call, and he said, "What do you need?" I said, "Send me I need warm bodies, just send them." And a group of them just all came to Addis Ababa, sat there, and every morning at 7 o'clock, we had a meeting at the EOC to begin to plan before the virus actually even hit Africa. When you look at political will, in February 22nd, I convinced the chairperson of the African Union. I said, "Mr. Chairperson, I need you to call all ministers of health to come to Addis Ababa so that we have a dialogue." Remember, only Egypt had reported 2 cases on COVID. I said, "Let there be no doubt, the continent is going to be hit with COVID," and hit hard. And this was a Saturday. An emergency meeting is called. The lady in green there is Dr. Moeti, and Dr. Tedros called in from Geneva. At that meeting, we agreed to have a joint continental strategy that was anchored on the need to cooperate, to collaborate, to coordinate efforts, and to communicate. We took the decisions of that meeting to the head of states. You can see it, the President of Senegal on the far side, President of Ghana, of Egypt, of DRC, there were a series of them. We said to the head of states, we need your political commitment. What is going to hit you on the continent is not a health issue. It is truly a security threat, an economic threat, and also a humanitarian threat. They endorsed that. Because of that political will, in January, if COVID had hit Africa, there was no laboratory on the continent that had any reagents to test for COVID. The first trainings took place in Senegal and subsequently in South Africa. But by August, nearly all countries had developed the platform to test for COVID. These are some of the trainings that took place, pictures that took place in Senegal and in South Africa. Subsequently, it became clear that we needed to establish a network of pathogen genomics to understand the different variants of COVID as they started spreading in Africa. So we went into full action and started training, pulling everyone together in the spirit of true partnerships to establish genomic sequencing across the likes of Tulio in South Africa and Christian Happy, all helped in setting up very quickly a network of pathogen genomics to understand what was going on the continent. Very importantly, leveraging the power of politics. No airlines were flying on the continent at that time. I went to the head of states and I said, I need a C-20 plane, military plane, to go to DRC in North Kivu to take our responders that were there and ship them to West Africa because they had no epidemiologists. The plane you see there is a C-20 from Cameroon or Uganda that the Peace and Security Council of the AU, African Union, said, you take it, Mr. Director, do what you have to do. So that was the only plane flying over the continent at night with responders and dropping them. At that time, it was a puzzle. Everybody was waiting to see millions of people died on the street on the continent. And we wrote a commentary in Science, which we said, the COVID pandemic in Africa remained a puzzle, but we needed more data because there was absolutely no way that we could know what was going on with limited testing at that time, very few responders. A paper was published in JAMA that said Africa had succeeded against COVID-19, the first wave, but the second wave was going to be challenging, and indeed it was challenging. We took on a detailed analysis and published that in the Lancet, which we titled it The First and Second Wave of COVID-19 Pandemic in Africa. And we, of course, more than 30% of deaths were beginning to occur on the continent, which, because of the massive lockdowns that we had encouraged the political leadership to exercise, and you see here on this graph, this is published in that Lancet paper. Each time you see a red, there it shows you where there was lockdown, but then you ease the lockdown, then you see a wave increase. Then you lock down the red, then the numbers decreased, but then they increased there. So again, it showed what I called a political courage, because without that political support, without the political trust capital that we had developed with the leadership of the continent, there was absolutely no way you were going to tell the head of states to lock down the economies completely. Partnerships. One of the partnerships that I learned from the COVID response in Africa was working with the private sector. If you pull out your phones and you type amsp.africa, a platform like Amazon.com will show up. I think it's still there. And that is a platform that the continent used at that time to coordinate the distribution of what I call health security commodities, diagnostics, PPIs, everything. If you pull that up, you see everything. So what we did was simply to work with people, the likes of Strive Masiwa, the Afri-Exim Bank, who were all behind. They were entrepreneurs and knew how to create a platform. I knew what I wanted, but I didn't know how to do it. They knew how to do what I wanted, and all I needed to do was to work with them every evening to create that platform. And if you Google that up, it will show up. But we gave a code to every country. We said, if you need your diagnostics, your PPI, you go in there, you put it in your basket, and you pay it, and then Ethiopian Airlines or Kenya Airlines will drop it for you. That's how the partnership, the power of partnership with the private sector. Probably heard, we know what the issue is, but most of the time we don't know how to create the solutions. Vaccines for COVID became an issue, and I will discuss a little bit of that. But it was a platform for partnership. And the slide you see here shows you the ability of how science has evolved over the years, and to be able to enable us to produce a vaccine for COVID between 12 and 18 months. The rest of the slide just shows you, for comparative reason, how long it took to create vaccines for other infectious diseases. So that is good news. But the issue of inequity or access to these vaccines became very, very problematic and created a lot of trust capital, that we have to build back that trust capital in global health in order to be prepared for the next pandemic. The Lancet wrote, and several others wrote, and I would like you to read some of the front covers. This is about COVAX. COVAX is an instrument that was set up by WHO, Gavi, UNICEF, with all the best of intentions to address issues of vaccine inequities. The Lancet said, a beautiful idea, how COVAX has fallen short. Médecins Sans Frontières was even more brutal. It says, COVAX, a broken promise to the world. Science said the global plan for COVID-19 vaccine fair shot will next time be different. But the truth of this is that of courageous leadership, that in public health and global health security, none of the solutions are easy, and none of the solutions are linear. So there's no direct relationship between input and output. I think I doff my hat to those who conceive COVAX. You have to have the courage, and you have to have the courage to stand the criticism like this. In the end, COVAX delivered vaccines and saved about 2.7 million lives. It could have done more earlier, but I think the mechanics were not in their hands. We created at that time, because of lack of vaccines, the head of state said, you go create your own mechanism to find vaccines. As Dan said, we managed to secure about 400 million doses of vaccines through the African Vaccine Acquisition Task Team called AVAT. And you can see some of those doses being distributed in Addis Ababa and several other countries there. Understanding the population that we deal with, so having the vaccines is one thing, but distributing those vaccines is also important. It's not a lesson for COVID alone, but a lesson globally as we prepare for global health security. This study was just published recently in Nature, and it shows vaccine hesitancy and compares the percentage change from 2020 and 2021 in several countries. And I highlight a few countries with the arrows, horizontal arrows, the UK. So it's not unique for developing countries or developed world. It's common. It's a common phenomenon. Why people are hesitant to receiving vaccines. If you look at the UK, the percentage drop has been 1%, Turkey about 2.7%, South Africa 21%, Nigeria up 26%, Mexico down 9.4%, and Ghana about 13 percentage points there. I think this is an important study that we have to factor as we develop our strategies for global health security. It's not whether the intervention is there, it's when we get that product, will the population take up that product? And community leadership and engagement and the trust capital has to be central to this. At the height of the vaccine inequity, we started receiving vaccines at that time in Africa. And there was a lot of uncertainty in the population as to whether they should receive vaccines or not. So we engaged the religious leaders. The picture on my left-hand side, your right-hand side, shows it's a church where we went into the church and said to the leaders, we need your help. You have to tell your congregation that these vaccines are safe and they are efficacious and encourage them to take it. Just that megaphone of trust from the religious leaders. After that, you saw that congregation lining outside, waiting to get their vaccines. Before and previously, when you showed up in certain countries with vaccines, people went to schools to get their children away from schools. The lesson here is that it's not enough to get that product, but we should think of population and understand what the population is and build the relationship with the population. Let me now conclude my reflection on what does this mean for global health security. Global health security is at a crossroad because of so many factors that are influencing it. The conflicts and crises we're dealing with, climate crisis, mass migration, artificial intelligence, challenges of physical space, food insecurity are all factors that we have to try to address if truly we have to be successful in managing global health security, in managing emerging infectious diseases. Secretary Blinken has derived this and has been very eloquent in discussing diplomacy variable geometry. And it applies so much true in global health security, where in essence, he defines diplomacy variable geometry as the ability to define the problem, then work backward and identify the right partners in size and form to address the issues. Given the complexities of the global health security, what I just described in the previous slide, we will need the ability to cooperate. If we cooperate, we will coordinate. If we coordinate, we will collaborate. And if we collaborate, we will communicate. That is the essence of diplomacy, variable geometry that we have to adopt to addressing the complexities of global health security. These are the threats that we face every day in global health security. But to address them, it doesn't only require that first bar, which is, as public health experts, our thinking immediately goes to having national public health institutes that conduct laboratory networks, surveillance, human resources. Global health security will rely on many other factors if we are to be successful, including the diplomacy I just mentioned, governance issues, the politics of financing. Physical space is getting very, very challenging. Climate crisis, manufacturing, decentralized manufacturing of commodities, the trust capital, behavior change, and mental health. We have to factor all of that if we actually have to have an effective global health security strategy. Lesson number 2 is inequities is a threat to global health security and is resilient. Where you have scarcity, as we saw during the COVID-19 crisis, immediately breeds inequality. We should refuse that. In 1971, Julian Haig published a paper in The Lancet entitled The Inverse Care Law, essentially saying the availability of good medical care and services tend to vary inversely with where the needs are in the population that they serve. It's about 50-something years ago. It is still true today. And we should guard against that and fight against the inverse care law if we have a chance of succeeding in global health security. We have all established the Pandemic Fund, which was launched by WHO just last year with the World Bank. Is delegated to making available resources to low and medium income countries to prepare them for, and prepare all of us to fight global health security or pandemics. It has raised about $1.9 billion. The first round, to the amount of about $330 million, has already been issued, and we're preparing to issue the second call for action. This is the kind of action that collectivity, the spirit of cooperation, collaboration, and coordination that will enable us to prepare. That is the same spirit that enables us to fight HIV/AIDS, as I indicated earlier, by the creation of the Global Fund, or PEPFAR. This is the kind of fund that we need to align ourselves to grow it to the level of the Global Fund. The Pandemic Accord is going on now, which is borrowing from lessons that we learned during the COVID-19 pandemic. It is an intergovernmental negotiating body whose aim is to come out with an accord by May of 2024 to address the shortcomings that we saw in ability or inability to coordinate our efforts during the COVID-19 pandemic. I call on all of you to work with your countries. I understand there are more than 100 countries represented here, but speak to your ministers, foreign ministers or ministers of health, to apply themselves and push forward with this accord. I think it's an important instrument. Lesson number 3 is we have to strengthen our national institutions, regional institutions, and global institutions. On August 1st, in the spirit of strengthening national institutions, Secretary Blinken launched the Bureau of Global Health Security and Diplomacy, which I had a great honor and humility that he turned to me and said, you have to lead this office. This office or bureau strive to do 3 things: to lead U.S. diplomatic engagement and support programmatic efficiency to strengthen global health security, architecture to prevent, detect, control, and respond to infectious diseases, including HIV/AIDS. Leverage and help coordinate U.S. foreign assistance and promote international cooperation. And lastly, elevate and integrate global health security as a core component of U.S. national security and foreign policy. We hope that the Bureau, as we stand it up, will lead with what we call data diplomacy, which is to use data-driven approaches, as we've done and used in PEPFAR, to strengthen global health security policy, enhance international cooperation, and address global challenges in the areas of sharing data and evidence-based decision-making, fostering international collaboration on data governance, promoting data security and utilizing data analytics for diplomacy, negotiation, and policy making. I believe that if we apply ourselves and learn lessons from HIV/AIDS and COVID-19, we can have a chance of better preparing ourselves for the future. Let me just conclude with where I started, with the concept of the 5 Ps. Important for us to know the politics, the population, the policy, the partnerships, and the pathogen. Thank you so much for the opportunity.
Thanks so much, John. Don't go away just yet. Yeah, please. Thanks so much, John. As I said earlier, it's always a learning event with you, and you did not disappoint this evening as well. We have a small gift for you. Please accept this plaque for your service and for your contribution.
Thank you.
So, thanks so much, John. Okay. Great. Well, there's still lots more to come. Thanks for that, John. So now we're going to move into the awards part of our program. For some of our young scientists, a travel award from ASTMH presents them with a once-in-a-lifetime opportunity to attend the conference, to meet with some of the real giants in our field, and to connect with friends and make other connections. And John, I think I'm responsible for your nervousness that you talked about, because everybody I talked to, I said, what should we do? What's like important? If it's the first time, I said, you got to hear John Nkengasong tonight. So that's why all the people came up and said they were looking forward to hearing you. But so we have 71 travel awardees this year, and so I want to thank everyone who supported this effort. These include the Bill and Melinda Gates Foundation, the Malaria Foundation International, Parasites Without Borders, the President's Challenge Travel Fellowship Fund donors, all of our subgroups, and anyone who made a donation during registration throughout the year. If you received a travel award this year, please stand up and be recognized. Thank you, and congratulations. Next, I want to recognize the recipients of the Burroughs Wellcome Fund. For many years, the unique fellowship has supported the career development of physician scientists focused on infectious diseases of the developing world. Well done to this year's recipients, who are Nima Briggs, Chasan Ilaiwe. Please stand to be recognized by your colleagues. Guessing they're out there somewhere. I can't see from here, but next is the Donald Krogstad Award for Early Career Malian Scientist. I remember Don very well and his wife Fran very fondly as mentors of mine when I was a younger scientist, an ID fellow, and a junior faculty member at Tulane. This year's recipient is Moussa Sangare. Moussa, will you please join me on the stage? The fellowship was started in 2021 by the family of Dr. Krogstad, a dedicated member and 1992 president of ASTMH, to support an early career scientist in Mali who is pursuing research aimed at blending laboratory and field epidemiological approaches. Moussa is on the Faculty of Medicine and Odontostomatology at USTTB, Bamako, Mali. I think we have a plaque for you. Congratulations. Thank you. Now to the results of the Young Investigator Awards. had the pleasure actually of announcing this twice today, since we had a session with them a little earlier, but the judging was held only today. Each year, on the afternoon before this opening plenary, Young Investigator Award applicants present their research to a panel of judges. If your name is called, please stand to be recognized, but let's save our applause until all names are called. Our 2022 Young Investigator Award winners are, this just in. So I'll announce actually 3 categories. We have the winners, and then first place mentions and honorable mentions. So the winners are Sarah Ali, Rachel Fay, Kaylee Herzog, Caroline Osoro, Anthony Torres Ruesta, and Daniel Sprague. First-tier mentions are Well Abrabu, Gloria Kakoba Aibaziboy, Jiaodi Zhang, Gina Cuomo-Dannenberg, Jenna Dick, and Olympia Lamberti. And finally, the honorable mentions are Sophie Moss, Akua Mensah, Majida Hamid Adioma, Rainier Tan, Mitchell Waldron, and Issa Mishani. So congratulations to the winners, but really congratulations to everybody who participated in that. You are the future of our society and the future really of our field of tropical medicine and global health. So whether you won an award or not, you certainly to be congratulated. We'll also post these results in the registration area. If you see any of the young investigators, please do congratulate them. I want to thank the corporate sponsor of the Young Investigator Award, Pfizer, and our friends of the Young Investigators, William A. Petrie, Jr., in memory of William A. Petrie, Sr., an anonymous donor, and all individuals who made a donation during registration and throughout the year. Thank you for your very special commitments and your continuing support of this important program. Judging was also held today for the Clinical Group Clinical Research Award. If your name is called, please stand to be recognized, and again, we'll wait for applause until all are noted. This year's recipients are, here we have it, this just in. Angela McBride was the first place recipient. Second place was Kofi Agyapong Ado. And third place, there was a tie, and for Akpayeji Yanel Dosu and Nadia Cantaneo. Thanks also to the judges who volunteered their time. As a society, we are fortunate to be able to offer a number of awards and fellowships throughout the year. This is due to the long-standing and excellent financial stewardship of ASTMH's leaders. You can see all these awards and the list of awardees in the program book and meeting app. Thanks to all of our committee chairs, committee members who volunteer their time to work on these programs and make these opportunities possible. We rely heavily on your work, and we're grateful for it. And this is no small amount of work. It's invisible to most of us, but a lot of people put a lot of hard work into making this happen. Now, the Society would like to acknowledge the 2023 Fellows of ASTMH. We recognize these members for their sustained professional accomplishments in tropical medicine and related fields. This is a high bar set by the Society, and Fellows of ASTMH, the recognition is open only to Society members. Will each Fellow please stand as I read your name? And again, I ask the audience to please hold its applause until the end. The awardees this year are Koya Allen, Fernando Bruno, Natasha Hochberg, Scott Lindner, Naomi Lucci, Richard Oberhelman, Shannon Rossi, Mahamadou Tiara, Niraj Tolia, and Paige Waterman. Thanks for all your hard work. We'll move on now to the Distinguished International Fellows. Because of time constraints, I will only be able to give brief highlights of all the academic or all the accomplishments for this group. Going in alphabetical order, our first Distinguished International Fellow is Subhash Babu. Subhash is an outstanding physician-scientist who has made seminal contributions to endemic infections affecting the Indian population, particularly in the areas of tuberculosis, lymphatic filariasis, and soil-transmitted helminths. He was one of the first to introduce and perform molecular diagnostics and other modern research techniques in the field of infectious diseases in India. Last year, he received the Society's Bailey K. Ashford Medal for distinguished work in tropical medicine. Well done, Subhash. Congratulations. Our next honoree is Alan Cowman. The significance of malaria research by Alan is reflected in over 350 publications and more than 48,000 citations that place him in the top 1% of researchers internationally. With over $65 million in funding, he has over 12 international patents related to antimalarial drugs and vaccines, some of which are in current clinical trials. Congratulations, Alan. Our next honoree is Patricia Graves. Patricia has held a remarkable career in global health research, advocacy, and policy determination. The main disease focus of her contributions has been related to lymphatic filariasis and malaria in Oceania, Sub-Saharan Africa, and Southeast Asia. She has an outstanding legacy of vector-borne disease research in low and middle-income countries. Her career in global health spans many critical dimensions essential for tropical disease control over 4 decades. These include basic science research, operational research, advocacy, policy development, and training. Congratulations, Patricia. Our next honoree is Jennifer Kaiser, who I was fortunate to meet earlier, a fellow resident of Switzerland. Jennifer is a leader in drug discovery and development for neglected diseases, including schistosomiasis. She is a world leader in all things neglected diseases, particularly those of the wormy world. As evidenced in her many publications, she is a key collaborator for many research scientists who seek to conquer neglected diseases. Her work spans the gamut from early drug discovery to clinical trials. Congratulations. Our next honoree is Marcelo Labruna. Marcelo graduated with a DVM in 1993 and has led the development of a highly interactive and effective network of scientists for the study of ticks and tick-borne diseases in Brazil and other countries in Latin America. His scientific achievements have significantly advanced the field of vector-borne diseases and improved the field's ability to diagnose, study, and treat neglected vector-borne pathogens. Marcel has also established a national tick collection of over 5,000 specimens that is a worldwide resource for the community. Congratulations, Marcelo. Our next honoree is Marie-Anise Salem. Maria is renowned globally as a preeminent Culicidea system creator and one of the pioneers in the use of molecular taxonomy to verify and explore species status, boundaries, and phylogenetic relationships within species groups. Her early grasp of the links between deforestation, mosquito ecology, and malaria epidemiology has led to seminal research on the role of patch sizes, edge effects, biodiversity, and forest cover on the primary malaria vector in the Amazon basin. Many generations of entomologists in Brazil initiated their training and research careers with Maria. Congratulations. Our next honoree is Eli Schwartz. Unfortunately, due to the conflict in the Mideast, Eli was unable to join us tonight, but nevertheless, I'll still go through his accomplishments. Eli is an internationally recognized physician, scientist, teacher, and leader in the field of travel and tropical medicine, as well as in global health. He has made seminal contributions to the description of the clinical presentation of tropical diseases among travelers, the non-immune population, as an important means of better understanding the natural history of tropical diseases. It led him to investigate new methods of diagnosis and new approaches to treatment. Good work, Eli, and we're sorry we can't be with us tonight. Our eighth and final honoree is Mauro Teixeira. Mauro is an internationally recognized leader in the field of immunology. His research on dengue, chikungunya, influenza, and most recently, COVID-19 has resulted in over 700 publications. It has created a paradigm for tropical disease therapeutics based on targeting mediators of inflammation as adjunctive therapy that do not interfere with the host immune response to infection. In 2009, he received the National Order of Scientific Merit, which is the highest honor given to a scientist in Brazil. Congratulations, Mauro. And now we will move on to a very special honor that has a personal as well as professional significance to the Society, and that is the Alan J. McGill Fellowship. I know many in the room knew Alan and loved Alan. Created in 2016 by the Society's board in partnership with the Bill and Melinda Gates Foundation, the McGill Fellowship honors the life, example, and legacy of Alan J. McGill, a deeply respected leader in the global tropical medicine community, who sadly passed away suddenly in 2015, a year after serving as president of ASTMH. The McGill Fellowship provides $50,000 in funding for up to 2 years to one recipient from a low and middle income country. These funds support mentorship, career, and leadership development for projects in tropical medicine to fellows who are in their early to mid-careers. A unique feature of this fellowship is the support of career-broadening experiences Alan McGill provided to many in this audience and around the world. Learning and leadership opportunities beyond those traditionally available in the applicant's home of organization, and in providing that makes awardees ready to assume future leadership and mentoring roles. Our 2023 McGill Fellow is Isiaka Sulama, a member of Burkina Faso. Isiaka, will you please join me on the stage? Isiaka aims to attain leadership skills that broaden and advance his abilities to strengthen the National Malaria Control Program's decision-making efforts for malaria elimination in Burkina Faso. Under the McGill Fellowship, Isiaka will be mentored by Diane Worth of Harvard T.H. Chan School of Public Health in the U.S., also a former ASTMH president, as well as guidance from Dawuda Njai in Senegal and Deushishan Goma in Tanzania, who was our 2019 McGill Fellow. On behalf of the Society and all of us who continue to be inspired by Alan, we are pleased to recognize you as the 2023 McGill Fellow, the 7th in a cohort of 20 being awarded over 2 decades. Congratulations, Isiaka. Our next honors are medals awarded by our subgroups. Each of these awardees will be honored during their subgroup's business meeting, so I encourage you to attend that. So I will only briefly announce the winners here, and the full details you can get from those, of their many accomplishments you can get from those meetings. Our first subgroup award is the Harry Hoogstraal Medal, awarded by the Society's subgroup, the American Committee of Medical Entomology, or ACME. The recipient of this year's medal is Jose Riballo of the National Institute of Allergy and Infectious Diseases. Dr. Riballo, will you please stand and be recognized? Dr. Riballo is a pioneer in the study of arthropod saliva that carries pathogens into the host. His career spans 50 years of commitment to research in medical entomology that inspired new fields of research and influenced many independent scientists in laboratories around the world. Congratulations. Our next honor is the William Traeger Award for Basic Parasitology, awarded by the Society's subgroup ACMCIP, or the American Committee of Molecular, Cellular, and Immunoparasitology. You can see why we call it ACMCIP, and named for the 1979 president of ASTMH. The recipient of this year's medal is Jonathan Marchant of the Medical College of Wisconsin. Jonathan has made a seminal contribution to parasite research with the discovery of the biological target of the drug praziquantel, the only FDA-approved treatment for schistosomiasis. His lab also discovered druggable targets and new drugs for treating parasitic flatworm infections. Congratulations, Jonathan. Our next award is the Dalrymple Young Award, awarded by the Society's subgroup ACAV, or the American Committee on Arthropod-Borne Viruses and Zoonotic Viruses. The recipient of this year's award is Nikos Vasilakis of the University of Texas Medical Branch. Dr. Vasilakis, will you please stand and be recognized? Nikos is a highly productive and creative arbovirologist pursuing innovative research related to the evolution and emergence mechanisms of important public health threats, including dengue and Zika viruses. Congratulations, Nikos. Our next award is the Communications Award. Karen Gorleski, will you please join me on the stage? Karen chairs the Communications Award Committee. She has asked me to help announce this year's winner. The Communications Award recognizes excellence in tropical medicine storytelling through the written word. Communications Award entries are judged on their ability to enhance the public's understanding and appreciation of tropical medicine research, clinical practice, and/or policy. Past Communications Award winners have come from the Washington Post, PBS NewsHour, Time Magazine, NPR, the Los Angeles Times, Nature, Science, and National Geographic. The Communications Award is judged by a panel of ASTMH members and communications professionals. Over to you, Karen.
So used to carrying my phone, I walked up here with it. This year's winning entry is entitled Small Victories. Nearly 30 years after apartheid's demise, a reporter revisits children's health in South Africa. It was published by Science last November 22nd and authored by Science staff writer Meredith Wadman. Meredith, please come to the stage. While you're making your way to the stage, I'm going to talk a little bit about your article here. So in 1986, you spent 2 months in South Africa as a visiting medical student studying pediatrics. This was during the time of apartheid. She worked on the pediatric wards at King Edward VIII Hospital, where Black people were obligated to seek care, and briefly she also worked in a small rural hospital far from the city. As Meredith wrote, I saw toddlers suffer and die from vaccine-preventable diseases such as measles. She saw a typhoid isolation unit that consisted of a crib placed in a corner of an open ward and newborns crammed 4 to a bassinet. She also saw white children receive high-end care at segregated beachfront hospital just across town. 36 years later, Meredith returned to South Africa, where she observed the small victories. That is the headline of her article. She saw major gains in child health more than 30 plus years later, but also widespread malnutrition and a socioeconomic system that fails the poor. She wrote, the end of apartheid didn't help Black people as they imagined and hoped that it would. Meredith, congratulations on an article that reported the facts and the history of what you observed, as well as the emotional aspect of all that you saw. I too read all of that, felt that emotion. Your reporting and writing are worthy of this year's Communications Award.
Where shall I put it? Yeah. Thanks. Thank you, Dan and Karen, and the committee that judged the applications. I'm tremendously honored to have this article recognized. It was one that was hard to report on many levels, and so I'm really honored and grateful to the Society. I'd also like to do a call out to my terrific editors at Science, particularly Jennifer Cousin-Frankel, Tim Appenzeller, and Emily Petersen, and to the South African photojournalist Gulshan Khan, whose wonderful work in South Africa last year really added a great, terrific dimension to the appearance of the article. Finally, the Pulitzer Center for Crisis Reporting, which supported the travel that allowed me to get to South Africa last year. I also just want to flag, because he had such a tremendous impact on me those many years ago, the contributions of Jerry Kuvadia, who was my mentor on the pediatric ward at the King Edward Hospital, and who arguably has done more for pediatric health in South Africa over the last 40 years than anyone else, and who was also a tremendous, courageous anti-apartheid campaigner. He's not well now, but he has influenced so many lives, and I'm very grateful to him. Doug asked me to talk about the importance of science communication, and I'll keep this very brief because I know we've had a long evening already. I just want to urge and encourage all of you to think of journalism as a vehicle to get your important work out into the world. I know that you trade in papers and impact factors and such, but it's so important for good scientific reporting to get out there, and it can't get out there without access to the likes of you. You know, you may have been on TV many times, as some of you I know here, thinking of Peter Hotez, have been, but you may never have spoken with a journalist, and I encourage you to not be intimidated at the prospect and to be open to the idea that there are ways and ways that your work can impact society for the good. I kind of see scientists' participation in the journalism project as a civic duty. So I urge you to think of that, and if any of you want to collar me, I'll be at this meeting throughout the 4 days, and I'm always looking for scoops and terrific story ideas, so if your work is just waiting to be told to the world, please, please approach me. Thank you all very much. I'm so grateful.
Thank you very much. Congratulations.
I've been told that I'm supposed to stay here.
You are supposed to stay here, yeah. So let's see how to approach this, Karen. As I mentioned earlier, Karen has been our CEO for 13 years. 13 years, that's a long time if you think back, you know, where you were 13 years ago. A lot of things have changed since then. And a lot of things have changed for our society. It's grown a lot. Throughout the time, and much of that time at least, I've had the privilege, because I was president for a few years and president-elect before that, and the scientific program chair before that, and on the board before that, and then I was probably 5 years old before that. But so I've gotten to work with Karen for a long time, and that has really been a privilege, and to see how she works. And we work together very diligently. She can be quite the taskmaster, and I'm sure if I could see beyond these lights, I'd see staff and ex-past presidents nodding their head, yeah, that she can be quite the taskmaster. But there was always time for a chat about other things beyond the society, to kind of recognize what was going on in the world, the good and the bad, and to have a laugh. And so I always appreciated that, and it always made my work fun. And of course, not everyone is so lucky to have worked with her directly that way, but I can tell you, if it's not clear from what you see around you tonight, And whether this is your first time or whether you've been coming and growing with the society and learning and laughing for many years, much of that is because of Karen's efforts in the last 13 years. So if you're here tonight, certainly recognize that and appreciate that. Karen likes pretty much everybody. There are a few exceptions, but I don't think we should get into names. But I think it is safe to say that one of her favorite people is an ex-ASTMH president and kind of our poet laureate, Chandi John. Chandi, could you come to the stage? Chandi, if you recall, a few years back, his presidential address was a series of beautiful poems, and he's quite talented that way. And he has kindly offered to pen something in Karen's honor, so I'll give the mic to Chandi.
Thank you, Dan. It's such a privilege to honor our wonderful, beautiful Karen. Any of you who know Karen at all know that she does not like to be in the spotlight. So when I was thinking of this poem, I was trying to think of ways to honor her in which she would feel honored. And I decided to focus on an aspect that is very, very dear to her and that has been a tremendous gift from her to our society. And I was kind of pleased that, coincidentally or not, it ties in really well with a wonderful address from Ambassador Nkengasong and the Communications Award. So the poem is called Advocate. Cleaved leukocyte, shooting for the moon. Stealthy virus, hijacking a duped cell. Fanged worm, questing for your blood. We see things hidden from the angels. We see them in the man with the cantaloupe jaw, the woman sputtering out each brittle word, the boy pale as diluted sand. And we know it is so very possible to halt this march to death. Think of the truths you hold closest to your heart. This. Every indelible fragment. Who knows them if you hide them in your room? The cardinal argues for spring, for the delicacy of all we would destroy. Learn from the cardinal. Advocate.
So it's kind of fragile to pass, but we have this gift for you, Karen.
Thank you.
And so
because it's not connected, right?
Yeah, it's not
okay.
connected. So we'll place it to your back, and you can get it later. But congratulations for all you do, and we'll give you a moment to say a few words.
Okay, thank you. All right. This is one time I am really glad I can't see anybody. And I am not going to put my hand up here to try to see anybody because I won't be able to get through what I'm going to say. So thank you, Dan. I can hardly believe it's 13 years. It's been an honor to both serve and lead this society. I think back to my final interview that included Ed Ryan, who was president at the time, and Peter Hotez, who was incoming president. Thank you, Ed, for your decision-making skills, your wise decision-making skills, because you hired me. What drew me to ASTMH? First, I'm a science groupie. I already knew of ASTMH and was fascinated by the science. I saw a society with a stellar scientific reputation, made up of caring and inquisitive men and so many women. So many women. From around the world, all working to find answers to diseases that in large part impact those who too often have no voice, no vote, and sometimes no recognition as a human being. The more I learned about this society, the more I wanted to be a part of it. You can see I drank the Kool-Aid from day one. This is my license plate on my car. And I was shocked to find out that it wasn't already taken. With the Society's foundation of solid science, I knew I could do a few things to elevate ASTMH, but I didn't and I couldn't do it alone. Building and maintaining a world-class team is something I knew how to do. I and everyone here is fortunate to have this top-notch staff team. Names you know like Judy and Buffy, and more that you don't, but I do, and every board member does, and so has every president and every board member that I have ever worked with. Together, through thick and thin, we have pulled in the same direction. I've learned about helminths, flaviviruses, the malaria parasite hiding in the liver. You don't think I could really not say something about malaria, right? About female genital schistosomiasis, the worrisome lack of parasitology in medical school curriculums, the tie between human and animal health, that hygiene needs a major public relations campaign, and how poverty is a striking constant through much of the diseases that bring us all here today. Thank you for everything you've given me. Several times a week, I drive past a children's academy in Alexandria, Virginia, where I live. Painted on this building are quotes from inspirational leaders like Ruth Bader Ginsburg, Congressman John Lewis, and this from Amanda Gorman. For there is always light if we're brave enough to see it, if we're only brave enough to be it. As I said at the beginning, it's been an honor. I've been a caretaker and an enabler of this light. You and the society are this light. ASTMH's best days are ahead, especially under the coming tenure of my friend and colleague, Jamie Benishi, in whom I have the greatest confidence. Thank you.
Okay, now I'll look. Thank you.
Thank you so much. I'll let you go on.
Wow, it's going to be hard to top that. But stick around. We're getting there. We're almost done. I know that everyone's looking forward to going and having a refreshment and continue on, but there's still exciting things to come, so patience for a little bit more. We will move on now to the Society's highest medals. I will read a short introduction from their nominations tonight, but of course I won't have time to go through all the details of all the incredible things these people have done. But we do want you to know more about them, so we've asked the people who have nominated them to make short videos, and those will be available on the ASTMH website and in the November newsletter. So we invite you to view those later on. Our first Society medal is the Bailey K. Ashford Medal. The Ashford Medal honors distinguishing work in tropical medicine. This year we have 4 Ashford Medal recipients. The first is Andrea Conroy of Indiana University. Dr. Conroy's work on acute kidney injury and chronic kidney disease after severe malaria has transformed our understanding of severe malaria. Her work could lead to new interventions that decrease mortality and disease severity in malaria. Her contribution to global child health goes beyond her great science. Dr. Conroy is a tremendous mentor, collaborator, and sponsor of trainees. She is building research capacity in lab science in Uganda in a way that few others can. Dr. Conroy, will you please come up to the stage to accept your medal? I think, let me just see, I think you have, can say a few words. It's not in the program, but
What's that?
yeah, I think there's opportunity for you to say a few words if you'd like to.
Okay, thank you so much. I'm incredibly appreciative of this award and the nomination and mentorship I've had throughout my career. I've had incredible mentors, Chandy John, Terry Taylor, Kevin Kane, and I think it's really important to recognize that this is an award that recognizes the incredible team I work with. So I just want to recognize my group at Indiana University and my incredible team in Uganda. So this award is really dedicated to all of you. Thank you.
Our second Ashford Medal recipient this year is Manoj Durasingh of the Harvard T.H. Chan School of Public Health. Dr. Durasingh is a professor in the Department of Immunology and Infectious Diseases at Harvard, having trained at Oxford University, the London School of Hygiene and Tropical Medicine, and the Walter and Eliza Hall Institute in Melbourne, where he was in the group of Alan Cowman, one of our distinguished international fellows recognized tonight. Dr. Durasingh's research program at Harvard has made seminal advances in defining critical interactions between the human red blood cell and the malaria parasites P. falciparum, vivax, and Nolaci. Dr. Durasingh, please come to the stage to receive your medal.
Unaccustomed as I am, but this is such a great honor. I love the society, and this is really an amazing moment. Of course, I'm a lab person, and you know, without a robust and amazing bunch of people in the lab, we couldn't really do what we actually do. So, obviously, I share this with them. And of course, you need mentors. I've had those in the society and beyond. Thank you all. And yeah, I did just take the opportunity to just dedicate this to my folks. Thank you.
Our third Ashwell Medal recipient this year is Philippe Garin of the University of Oxford. Professor Garin has worked in tropical medicine for 25 years, leading research to improve the outcomes for some of the world's most vulnerable populations. His interest lay in using data better to further that research. Since 2009, he has led WWARN, the Worldwide Anti-Malarial Network, a collaborative data platform generating resources and reliable evidence to inform the malaria research community. And in 2016, IDDO, the Infectious Disease Data Observatory, which was founded to build on that work across selected infectious diseases, including emerging and neglected diseases. Professor Garin, please come to the stage to receive your medal.
Well, first, thank you, Abby, for nominating me, but I'm thrilled to receive this medal. It's also, as my colleagues say, a recognition of the hard work of the many colleagues I have the privilege to work with. I'd like to particularly acknowledge the people who have been part, and there are many of them in the room, of the development of WARN and subsequently IDO. This is a medal which is for you. Not sure how we're going to split that, but thank you very much.
Our final Ashford Medal recipient this evening is Matt Lawrence of the University of Maryland School of Medicine. Dr. Lorenz is one of the world's most innovative and accomplished mid-career tropical infectious disease clinical trialists and an important leader and educator in tropical medicine and global health. His studies in the U.S. and Africa have included blood stage malaria vaccines, heterologous controlled human malaria infection by Plasmodium falciparum sporozoite injection, HIV malaria co-infection, chemo and radiation attenuated PF sporozoite vaccines, and typhoid conjugate vaccines. As coordinating investigator, he now leads the world's first clinical trial of an mRNA-based malaria vaccine. He is a mentor to many young researchers, including many from resource-limited settings, thereby training a new generation of scientists. Scientists, physicians, and physician scientists with a focus on global health. Dr. Lorenz, please come to the stage. Sneaking up on me.
Wow. Thank you so very much to the Society for this honor. Thank you, Steve Hoffman, for nominating me. And thank you, first and foremost, to my family who supports all of the work that I do, and you keep me grounded. Special thanks to the collaborators and mentors I have internationally at the MRTC in Bamako, at GRA in Ouagadougou, Burkina Faso, at the Malawi Liverpool Wellcome Trust and the Blantyre Malaria Project in Malawi. And thanks to my home team at the Center for Vaccine Development and Global Health at the University of Maryland School of Medicine. You inspire me every day, and I just thank you very much.
Our next award is the Clara Southmaid Ludlow Medal. The Ludlow Medal recognizes male and female honorees for their inspirational and pioneering spirit and for work that represents success despite obstacles and work that advances the field of tropical medicine. This year's Ludlow medalist is Diane Worth of the Harvard T.H. Chan School of Public Health. Dr. Worth is a scientific innovator who has significantly shaped the fields of malaria genomics and drug discovery. Just like the iconic individual this award is named for, she achieved success in a system that was sometimes stacked against her, overcoming obstacles with grit, excellence, and dignity. She has been a role model and inspiration for a whole generation of scientists and a mentor and supporter in particular for women and researchers from malaria endemic countries. Congratulations, Diane.
Well, thank you very much.
You got to get the medal first.
Ah, I got to get the medal first, sorry.
There you go.
Thank you.
Yeah, please.
Well, thank you very much, and you indeed can't see anybody up here. Let me thank Julian Rayner and Christy Petersen for this very kind nomination. ASTMH has always been my home society, and I am truly honored to accept the Clara Southmaid Ludlow Medal. Clara Ludlow was a pioneer in her time, the first PhD and the first woman to join the society, and there's no looking back. It is a fascinating and exhilarating time to be in this field. The challenges of global health have come to the spotlight, and the best science is being applied to the most neglected diseases, and we are seeing progress. For me, it's been an exciting journey, and I feel privileged to have been in the field and played a small role. There are many to thank. Thanks to my family, my parents for letting me pursue my dreams, even if it wasn't their dreams, and especially to Peter, my husband, for his enthusiastic encouragement to follow my passions. And thanks to my lab family, the many scientists I have trained and mentored, the collaborators, the colleagues from across the world. Science is indeed a team sport, and it is because of them that I stand here today and it is on their behalf that I accept the Clara Southmaid Ludlow Medal. Thank you.
Our next award is the Donald Mackay Medal. Since 1990, ASTMH and the Royal Society of Tropical Medicine and Hygiene have joined together to award the Mackay Medal, which recognizes outstanding work in tropical health, especially relating to improvements in the health of rural or urban workers in the tropics. The Mackay Medal is presented in alternate years by the Society of our Society and the Royal Society of Tropical Medicine, who are with us this year, and we're delighted to have them here in the audience. Our Mackay medalist this year is Maria Friedli of the WHO Congo. We all know her better as Maria Rebollo. Dr. Rebollo is a dedicated, dynamic, thoughtful, creative, and compassionate global health practitioner. Her outstanding work has largely focused on the most neglected tropical diseases and has supported millions of subsistence farmers, fishermen, and workers at many levels. She strives relentlessly to do her work in a way that supports and encourages local capacity and growth of technical and professional staff within the countries and communities she works, honoring each individual contribution. Dr. Rebollo, please come to the stage.
Thank you so much. As we all know, the Mackay Medal highlights health workers and those that work to train them. So when President Dan Bausch gave me a call to tell me that I was receiving this medal, it immediately came to my mind when, over 20 years ago, I met my friend Chanceline in rural Cameroon. She was exactly my same age. She was frequently pregnant from different men, and she was also HIV positive. So in her latest pregnancy, I encouraged her to go to the health facility and get antiretroviral treatment to protect herself and her child. What I could not imagine was what was going to happen next. When she went to the health facility, the health workers absolutely denied her access to treatment. They accused her from being a prostitute. They said she was killing their men, spreading the virus around, and they said she deserved to die. So that triggered on me to put in place a program to train health workers, to fight the stigma, to really empower them to provide access to treatment to the people that are the most vulnerable. And it made me understand that health systems are fundamental, medicines and diagnostics are critical, but what is absolutely key and what really gives sense to all the work we do in this room is those frontline health workers that really provide access to treatment to the most vulnerable people. So thank you, ASTMH, for this medal that I dedicate to those people around the world that are suffering to get access to treatment, that are really patients that are vulnerable, that cannot really have access to the treatment they deserve. And also to the health workers that are in the front line, fighting every day to give access to treatment to the most vulnerable people, particularly those that suffer from HIV and neglected tropical diseases. So thank you so much for everything you do, and thank you for your kind attention.
Okay, we will move on to our final award of the night. Before I do that, I think I still need to thank Buffy for all her assistance. A hand for Buffy. I might as well add all the other staff and ASTMH staff and others who have made this happen tonight. So. Our final award is the Walter Reed Medal. The Reed Medal is the Society's highest honor. It is awarded each year to recognize distinguished accomplishment in the field of tropical medicine. Thank you to Drs. Mark and Cindy Cordepeter for their generous sponsorship of the Reed Medal again this year. This year's Reed Medal Award is awarded to Charles Kalischer. So you can see, we initially asked Charlie, most people know him as Charlie, to send us a photo to use in the awards program, and this is what we got. Anyone who knows Charlie will not be surprised at all, I think. Charlie can be irascible, but he is also a consummate scientist and professional. He was nominated separately this year by two of his colleagues, Dr. Tom Monath and Professor Pedro Vasconcelos. They noted how Charlie has made seminal contributions in the fields of arbovirus taxonomy, ecology diagnosis, and medical relevance of arboviruses through hundreds of scientific papers, chapters, and books on arthropod, bat, and rodent-borne viruses. He has inspired students and peers alike and instilled in them a thirst for knowledge and love of his chosen field. Charlie has played on the global stage, working and collaborating on projects in 41 different countries. His unique character and devotion to legions of friends and colleagues have earned him worldwide recognition. Unfortunately, Charlie cannot be with us tonight, but he passed along the message for me to read. I consider the ASTMH annual meetings to be the highlights of my professional life from the time I joined the Society and attended my first meeting in 1965. Woody Allen wisely said, 80% of life is just showing up. That's what I did. Encouraged and supported by many remarkable co-members of ASTMH, way too many to mention here, I became increasingly fascinated by arboviruses and other viruses. That portion of my life has not ended, and I encourage others to delve into these causes and non-causes of human and wildlife diseases in order to gain further insights to what fascinated you when you were younger. It's better than having a job. With my best regards to you all, and sincere apologies for not being there with you, Charlie Kalisher. We shipped Charlie his medal earlier this month, and we know he is watching the live stream with us tonight. Charlie, I hope you have that medal around your neck right now. It's well earned. So that brings us to the end. I can't think of a better way to end tonight's opening plenary except to say, who's up for some refreshments? Thank you for joining us. Please join us and our 2023 exhibitors for the opening reception in the Riverside Center exhibit level East Tower. Enjoy your time in Chicago. Enjoy the meeting. Thank you very much.